Morning, everybody. Today we are talking on naturopathy for women's health. Okay, so if you are thinking to go to naturopath, and if you have any questions, please join in, and then put the comment through. Okay, all right. I'm going to say hello to everybody. So hello everyone. My name is Anjali, or Anjali, you want to call me, and I'm health and wellness coach. Of course, I'm the founder of this page. And today we have beautiful Kristin from Cape Naturopathics. And I would like to say, introduce her with this beautiful write she has written. Kristine says she is passionate about meeting people where they are at, doing thorough health assessments, and building health teams by collaborating with GPs and other allied health practitioners, and ultimately empowering clients with knowledge and support to be creator in their health journey. Okay, and there are hello everyone, thank you for coming, and if you can hear me, please give me a thumbs up. Okay, thank you. She specializes in ADHD, complex chronic conditions, reoccurring thrush, BV, UTI, pelvic pain. Hi Kristine. I'm just introducing you, and so you specialize in peri-menopause, endometriosis, PCOS, comprehensive health checks, and I just wanted to ask, what is BV?
Bacterial vaginosis.
Oh, okay. I was like, BV. Okay. Oh, I didn't get a chance to go to Dr. Google, Thank you. Please everyone, welcome, help me to welcome beautiful Kristin here to our page. Thank you so much for your time, and we truly appreciate your knowledge and time and everything about. Okay. Yes, no, and thank you. And before we start the conversation, I just wanted to talk is about educational and then awareness purposes, and not a curated plan for anyone, especially made for anyone. Would you like to add anything in that?
Yeah, I think it is important to realise that any health advice given is, it's just general advice, and that, everyone's individual. Always seek any sort of health advice. So this is just for general information.
Yes, general information, and so we can help and spread out the words for our naturopath, area, right?
Absolutely.
So we will start with our first question. So who is naturopath? And I saw in your bio, so you said that you are integrative naturopath. So can you elaborate on that, please?
Yeah, sure. So I'll start with what is a naturopath, and then I'll talk about the integrative naturopathy. So a naturopath is understanding the healing capacity of the body and utilising natural things to really support the healing vitality of the body, and naturopaths really focus on treating the underlying cause. So we take nice long consults, we really look at all aspects of someone, and utilising the healing powers of nature. So whether that be diet, lifestyle, herbal medicine, supplementation, different like that. So natural for the natural healing of the body. And one thing that I feel like naturopaths do really well is, as I mentioned, like really passionate about treating the underlying cause. I think that's something that a lot of people really do want. It's not just ameliation, like really looking for that. Actually.
I think more and more people are getting open about this idea of just taking medication is just masking the pain, and understanding what is the root cause. I think more and more people are understanding that that's the way to go. Yes, and so that's amazing that more and more people are getting becoming conscious about it, you know?
Yeah, and it's really interesting because something I do see a lot is, you know, especially when you have chronic symptoms with something, you can get a bit down about it and it's like, oh, this symptom, just want this symptom to go away. But the symptom is always a message because it's the body is always trying to make homeostasis and balance.
Yes.
It's an invitation, and I think being curious about that and working with that symptom and actually really restore that balance. So, and then understanding the interconnectedness of everything, of all body systems. So, you know, we know now quite clearly about the gut-brain connection, the nervous system immune connection. But even that we as people, as beings, are, you know, multi-dimensional, interconnected, like body, mind, spirit. So, you know, really understanding that and treating on all those levels is empowering as well.
Yeah. So, okay, so that is the naturopath. So what is integrative naturopath now? Yeah,
so integrative naturopathy is sort of a relatively more modern term.
Yes.
And I think around and I sort of jumped on it. I was like, yeah, I want to be an integrative naturopath because I think what it means is, or what it means to me is that we're very much seeking to sort of integrate with other health practitioners, especially GPs. Like, it was always my dream to work with GPs, and I got to do that for a number of years working with Dr. Oscar Serelak, who wrote the postnatal depletion cure and supported natal clients. And that was just so thrilling because it was like Dr. Naturopath side by side, sort of putting in both the skills. And it was really a beautiful way to do medicine. So to me, integrative naturopathy is, really connecting with health teams and being integrative in the approach. I refer to Chinese medicine practitioners and osteopaths and GPs. And, you know, as a team, we're really addressing all that, something to really actually,
that is what I, that is why I wanted to bring this page of health and wellness, you know. So the modern medicine and then the traditional medicine come together, and and then so we can help people the best way we can, you know. It's like not your way or my way, but if the, you know, because the conditions can be up to any level, or, you know, sometimes something might work and the other thing might work, and when people get to have a choice, you know, and that is when I think the best outcome is, isn't it?
Yeah, 100%, definitely. And it's amazing how supported people feel when it's like that. And I know it's potentially overwhelming and expensive, but there's definitely a way that you can just stagger it and weave it, and as long as the thread's being followed, then it does. So it's a beautiful way.
Yeah, I love that approach, and so it enlightens to my page. I love it. So the next question. So what can our women community can expect when they come to you?
So generally I do a 60-minute initial intake.
Yes.
That's for, might have a few things going on, and they just want to address that. If someone has a sort of more chronic health history and quite a few things going on, then I recommend a 90-minute session. Once we have that initial assessment, first up we're really delving into the symptoms and what's going on for that person, and just really exploring that in detail. So if it's something with their period or sort of a headache or a gut issue, then we're really that first start, what's associated with it, what makes it better or worse. Let's describe it and work out when it's happening. So we cover that initially, and then I'll do a bit of housekeeping and just check on any medications, supplements, allergies, and do a full diet diary, typical, what you're eating and drinking, covering caffeine, alcohol, all the food groups, etc. exploring potential for food intolerances. And then I'll do a full systems review, which is looking at all the different body systems and just sort of firing out some questions around the cardiovascular system, the immune system, hormones, etc., and just sort of systematically going through, and just it's amazing how many little things crop up in when someone does.
I bet. Yes, it's women's health is so like intertwined, isn't it?
Definitely. Yes. We're very, we have this like orchestra of hormones going on. So
well said.
We're pretty done at being a woman.
Yes, we should be proud.
Yeah, absolutely. Well, we have all these superpowers, but then subject to, overwhelm for taking on too much. Just the name of it. So we'll do the full systems review, and then at that point, sort of towards the end, depending if it's, sometimes I do say, look, there's quite a bit here and I'm just going to sit with it, and then I'll do some research and I might sort of just sit with which herbs I think, but other times I'll, put the plan together. And the plan typically involves some diet and lifestyle adjustments. I'm really passionate about keeping it really simple and not making it overwhelming, especially if someone's already overwhelmed. So just things, and then introducing some herbs or supplements to get started. And if someone hasn't seen their doctor for a while, I'll refer them back to their doctor and put some suggested bloods down, do a good panel and a good thorough check through. And then usually when they come back for their second appointment, we can see how everything's gone, and then we've got results and we can just sort of fine tune everything. And
So when you advise the herbal medicine, that the GP must know that what the patient are taking.
I do put that. Do you mean what supplement?
No, because no, I'm saying that because lots of times, even including myself a few years back, I'm just taking herbal medicine, so I don't need to. If my doctor asks me, so are you taking anything? And then, no, I'm not. It's just and I thought it's just a herbal thing and it won't give me side effects, or it won't. But then once I start doing the study, and some of the medications, the herbs can how do you say it? Contraindicate?
With
medication. Yes. So it is must that you should let your naturopath or your doctor know that what you're taking, even if it is herbal supplement or things like that, right?
I always encourage people to take their full plan to the doctor as well. But the thing is that a lot of doctors don't really know about the herbs, so I put a disclaimer on all of my plans, and if they're not taking any medications when they come to see me, I ask that they let me know if they do get put on a medication, so that I can check the herbal medicine. And always I have a checker. I just always make sure that that's covered. And I really like to write letters to doctors as well, and just introduce myself and this is what we're doing, and this person's got this blood pressure issue, they're on this medication, I'm using these herbs, it's 2 hours away from, I've checked the safety, what do you think about this? So I really encourage those conversations so that best practices.
So I want to ask our viewers if they have ever done that, I think you might be smarter than me, but, if you have ever, the herbal medicine is it's just herbal medicine, so I'm not going to, if you have done it, just give me a laugh or whatever.
So many women are asked, are you on any medications? No, I never take medications. And then I'm like, are you on the pill? And they're like, yeah, I'm on the pill. I'm like,
yes. No, the pill is, but anyway.
That I was reminded of yesterday going to the dentist was just, a week before surgery, you need to stop supplements a week before surgery as well. Having that conversation with your doctor. Yeah, so there would be some that would be okay, but it would need to be guided. Yeah.
Yes, like things like turmeric, right? Because it is the blood thinner.
Yeah. Yeah. Well,
it is blood thinner, or yes,
just
like
they all work in different ways, like
yes.
liver. The liver and things.
Yeah.
So. Yeah.
So my client told me once, she wasn't allowed to take any turmeric because the doctor told her to stop taking because she was going under the operation. So anyway, so we covered 2 points. So who is integrative naturopathy, and what can our women community expect when they come to you, right? The third one is, can people visit you like GP regularly, or it depends on the condition, or how does that work?
Yeah, it really depends on the condition completely. Yes. I do a lot of clients where I'm mostly their primary healthcare practitioner, but I'm a very safe, probably over safe sometimes practitioner. I'm always referring back to their GPs if there's any question mark. For example, something that haven't treated it for a while, but over the years I've treated a lot of UTIs. A lot of clients are like, I've got a little bit of a niggle of a UTI, and I'm happy to treat that if it's in the beginning stages and they don't have a fever or anything like that. But I always say, like, if it is not getting better in 48 hours with this treatment, then or if you develop a fever or any blood in your urine, you need to just go straight to the doctors. So, always safety first, but certainly colds, flus, getting a bit stressed or not sleeping, or make up a sleep tonic. So for certain things like that, for sure, but I definitely, there's a very clear roles with each person, and I always say, like, just go and get it looked at with the GP for a second opinion if it's so.
Yeah. Third question. And then the fourth one is, what are the most common women's health issues that you come across? And and then if you have any points to give away.
Yeah. I think the most common thing I see with women is fatigue, like just dragging through the day. That's probably the most common, and closely followed by brain fog. A lot of women say they have brain fog, and really hard to just give sort of some advice on that. Basically, a good place to start, other than, you have to assess iron and thyroid and make sure that there's not other cause behind it. So we're going to be doing that in a consult for sure. But even just getting some basic nervous system support with either herbal medicine or some basic nutritionals, taking a little bit of magnesium and a bit of B vitamins. Just those basics can really help. And I think also just following a really clean diet for a couple of weeks, there's a little bit of a gap, like nothing, but just really following a whole food diet where you're sort of not having any packaged food and just coffee and just those basics. I think setting an intention, doing some really basic nutritional supplementation and a good diet, and just doing that 5-minute meditation practice every day. Things that are completely achievable but do take that sort of focus, like
commitment.
I'm going to do this just for 2 weeks or just for a week, like time frame feels achievable. It's not necessarily going to fix it, especially something underlying, but it can definitely put you back into the driver's seat of, okay, what do I need to do to manage myself rather than being steamrolled by life right now?
Yes. it's with us, you know, women, especially mums, we always put ourselves at the end to the last, right? So we have to understand that if we look after ourselves, then we can look after other, you know, people, the people we love. But we don't understand that. I didn't understand until last year, you know, that how important it is to look after ourselves. Then we can look after our loved ones. It's so I wanted to you know, put the stress on that look after yourself, and then you can look after the kids better.
Yeah.
You're a better mom, you're a better partner, and because you are feeling so good in yourself, right?
Yeah. Yeah. And it's weird, but it's like whenever you do that, it's like, it's almost like the whole world reflects back at you that positive change. It's like it ripples go wide when you do basic things. And I think that as women too, and I know that I do this and have done it a lot in the past, where I think, oh, I feel like this, and oh, it's going to take me months to fix this, get better, or, you know, and often it really isn't. It's like we're as vital beings that just want to be vital. So it's just like just adjusting things slightly can make huge
difference.
Yeah, definitely.
Yes, amazing. Yes, thank you for that. And it's better to assess properly before we give advice, right? Because I mean, it could be so many.
Yeah, I'm always happy to do I offer just a short acute consult. I'm always happy just to prescribe as long as I've checked through, you know, medication, and, you know, let people know that they might need to get those things checked. But always happy to prescribe a few basic nutrients, like an over-the-counter consult. So yeah. And a few other areas that I really commonly see with women, a lot of hormonal things, like the endometriosis or PCOS or pelvic pain, unexplained pelvic pain. I'm really passionate about that because medically that's not really treated, and that's a classic example of a condition where that might involve the microbiome in the gut, so the gut bacteria being balanced, the immune system needing support, the nervous system needing support, doing something topically with the vagina, the microbiome, the bacteria in the vagina, and just like really assessing that holistically, because I think a lot of women that have that condition do feel like quite you know, that there's not very many answers out there. So that's a condition. Yeah. And I did a lot of work, as I mentioned, with Dr. Oscar Saralak doing the postnatal work. So doing really thorough postnatal assessments with their nutrients, the system work, and his book, The Postnatal Depletion Cure, is a whole book written on this. So it's a beautiful reason. And then in more recent years, especially now that I'm coming into this era of peri-menopause, is I've been doing a lot more research in that area, and it's such a changing landscape for women. And I heard the term QUEENAGER, and I really think that
I love it. QUEENAGER.
Like going through years, like everything's changing. But there is this sense of empowerment that comes with it, and I think educating women for this change, and you know, peri-menopause can happen, you know, many years before the menopause. So just getting resourced and sort of ahead of the curve, if you know what I mean, and getting that can really help women transition into this sense of being a queen, like, you know, being empowered, being in the young and still young and centered in their lives and just ready to go.
Yes, like that reminded me of yesterday, the Glow Physio. She put a post saying, why don't we change the term called midlife crisis? Why can't we say this is the time when we are restarting or re-beginning, or, you know, rebirthing, or, you know, the exciting, you know, restarting everything, amazing time ahead, or into positive instead of calling it midlife crisis.
Yeah.
You know, because we reinvent ourselves, we are so open, and we understand ourselves better, and we are not upset with the little things anymore, or don't care or what other people are going to think as much. So that was very very good point there. A QUEENAGER, I love that. I'm gonna write this down. Oh, I love it. Okay, and we're a bit. Oh, we're 11:27. Okay, we're going to. I wanted to ask another important question, that if the naturopathy is covered by the if the government funding or fund, or the or private healthcare.
Yeah, unfortunately, it's not anymore. It used to be covered by by private health cover, but as of about 3-4 years ago, I think it's a political issue with naturopathy, because it's sort of seen to be alternative, and I feel like this still harkens back to the pagan and the Christian days, where it's almost like them, and it's most naturopaths are so educated and passionate about helping people. It will be a beautiful day when naturopaths and GPs can stand side by side, like in terms of I mean, we already are, it's already happening.
Yes.
I in my practice, so many beautiful GPs that I just recognise the value of the work, and but unfortunately at this moment, no health fund, there's no rebates or anything, which can make it unaffordable for some people. But it's really important to recognise that most naturopaths will offer like a shorter appointment, and will pretty much give you their heart and soul in that little 20 minutes, and they can. Plus there's also a lot of free over-the-counter consultations available in a lot of health food shops, a lot of chemists.
Yes, true.
Those naturopaths are just raring to help. So,
yes.
realize that, like, if you have a cold or a flu, or your child's unwell and you want like a bit of basic support to get started, but you can't really afford like a full consult, then just utilize that. It's a free resource, so definitely.
In lots of health food store, they have naturopathy.
That's right.
Done that.
Yeah.
That's a great idea. Yes. So I wanted to put the question to our viewers. What do they think? We have to sign a petition saying naturopaths should be covered.
Yeah.
And we have to bring up voice for that.
Yes. Yeah. It's quite a complicated issue. It's got many layers to it. Generally, I find now, especially, that a lot of people are becoming so educated themselves, and there was this great guy that came out from the States years ago, and he wrote a book about integrative medicine, and that concept of hive mind, and how naturopaths and doctors and specialists are people that have done all this study and that are highly specialised. Like, you might see them a few times a year, but there's all these other people that, your physios, your coaches, like the great work that you do, Ange, and all these other practitioners that are able to all work together, but you don't necessarily always need that sort of more expensive consult that frequently, which is sort of like, if a client's doing everything that I tell them to and are really applying themselves with that, then it's change can happen pretty quickly in that sometimes. So
yes, it just a little bit, like almost, it feels like not fair, like getting in a tantrum mode. but that's okay. It is what it is, and hopefully it will get better. And like you said, everyone is getting more conscious, and getting more educated about this area, and they're coming to know that, and if I can't even talk about the back home, naturopath, or, there is no such thing. We just go to natural health place, but we don't even know if they have any certificate, or if they have learned in a village, like to
Yeah.
bring all the herbs and medicine. But we don't know. We
Yeah.
can't see any certificate or anything. But here, everyone is so well educated, and they have to have a certain degree, and they have to have, whatever they're doing. It's so, like well regulated. So
Yeah.
I think, yeah, and we will get there one day.
Yeah.
Yes. Yeah. So, and so I wanted to know. Yes. Sorry. Did you want to say something?
I just said, yeah, excellent. I look forward to that day.
Yes, me too. So I would like to ask our viewers if they have any questions, or anyone who is watching our recorded one. So if you have any questions to Kristine, please DM her, and then contact her, and then get to know her, and even if you're thinking to move towards the natural, go to see naturopath and want to have a little talk, yes. So and while we're waiting for the questions, would you like to say a little bit about yourself and your service?
Yeah, on that note that you just said, I do offer like a free 10-minute discovery call for any questions as well. So if you have like a condition that you're wondering about booking in with, or just want some basic information about, then just that 10-minute discovery call, just book it in our website for sure. And offer a 30-minute wellness consult for someone that maybe can't afford like a full consult, where we'll streamline the appointment and just cover things a bit quicker, and that can at least get someone rolling with seeing their GP and what to ask for, basic treatment. But yeah, I've got a beautiful practice in Byron Bay, and I've had my clinic for 4 years, and this is the culmination of a very long dream that I had years ago. I moved here from Western Australia to study at Southern Cross Uni. I moved here with my daughter as a sole parent she was 4, and I got through my degree as a sole parent with very minimal support, apart from all the beautiful women in this great community. So hallelujah to women.
It's amazing what you can do. Yes.
Amazing. And she had such a great childhood, lots of and then I worked in many different practices over the years, and then about 4 years ago decided to start my own practice. So I treat a lot of different conditions, and recently I've just launched an ADHD package.
Amazing.
This is for kids and for adults, unmedicated, and it's an educational sort of package, as well as sessions, series of sessions.
So there is a ADHD week we have. At that time, I think it would be great to talk about that topic, not just because I think because it's so almost like very saturated, these days. It's like, oh, this one has ADHD, that one, and we don't know. Lots of people, we don't know what it is, So I think you just understanding what it is, and how it affects the family and the kids and even the parents. And I think it'd be that's amazing.
Definitely.
So will. That will be another topic. And yes, and thank you so much for coming today, Kristine. We truly appreciate your time and all the knowledge you have given us and shared with us. And we'll see you next time.
Sounds wonderful. Thank you. Thanks, everyone.
Have a great day. Bye. Thank you, everybody. Thank you for coming. Bye.